Alrighty, I am just a few miles from home. I wanted to interject this to the beginning of the video to warn you of a couple things. I do give a pretty complete history of my heart issues at the beginning while I was driving down there, and I just wanted to let you know that as such, this is a rather long video. I will at the end provide you a synopsis of MUSC's findings as far as we know for now, but I did want to warn you, this is a long one. Alright, so welcome to the recap of my weekend. Today is Sunday. Sunday. It is 2:25, and I guess I shouldn't call it my weekend because this is kind of the end of the weekend. But let me give you an explanation of the next, well, we'll call it 48 hours. For those that don't know, and I'm going to do this for the people who have not watched these videos before, because I probably will share this video with people. I'll give you the whole story since we've got plenty of time. I was born with a heart murmur. Technically, VSD, ventriculoseptal defect. That means one of the ventricles of my heart, which is the bottom chamber. Damn, those cyber trucks are ugly. Wow. Okay, sorry. The bottom right side of my heart, excuse me, there is a hole in the septum. And the reason they call it a murmur is because when you listen to it, it doesn't sound like a typical heartbeat, which theoretically would be boom, 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 because mine doesn't do that. Mine goes whoosh, boom, whoosh, boom, because that blood just kind of squirts through that hole. And that's the way it's been since I was born. I don't remember exactly because I was just a kid, but when I was around 12 or 13, they made a big deal about it locally, because we moved to Greenville when I was almost 7. So I guess it was maybe the first time I was going for a sports physical. I don't remember if those two correlate or not, but I kind of have a feeling that's what it was. And being as that we were fairly new in Greenville, we were dirt poor. I don't know if I had I guess I had my regular pediatrician, Dr. Ted Harris, rest in peace. So I don't know if he sent me to this other place or not, but or if we wound up there because my father was a student at Bob Jones at the time, but we wound up at Barge Memorial Hospital for Dr. I think his name was Seitler, who is a notable name on that campus and in Greenville's conservative Christian realm. And I don't remember anything new or dire or notable, or I don't remember anything coming from that. I was cleared to play sports. I always played sports. At some point later, I don't know if I was still a teenager. I kind of think I was. And I kind of think it was Dr. Harris that said, let's just avoid heavy lifting, which I always thought was funny in hindsight, because in my 20s I got into powerlifting and I was lifting some pretty heavy weight and never had an issue, but for one time, and that more than likely was more related to my breathing, not my heart. I did have a about to black out moment one day when I was lifting, but that was just one time. And if you watch Instagram and you see how often people do black out from heavy lifting, it only happened to me once. I am pretty conscientious about my breathing when I'm lifting, especially heavy. So it's always been kind of innocuous, asymptomatic, whatever you want to call it. It's never been a problem. About 10 years ago, almost 11 now, I met with my older brother's family, downtown Greenville for a birthday dinner his two girls' birthdays are a day apart around Halloween. And so we were there for a dinner. And I started to have what I thought was like a panic attack. Never had one before. Had been around someone who claimed to have them, but they were a little bit of a hypochondriac, so I never really knew for sure. And it was always my chest is so tight, I can't breathe, blah, blah, blah. Well, that's what I started having. Not like I was going to pass out or anything. I was just uncomfortable, couldn't catch my breath. And excused myself from the table, went outside to try to get some fresh air and see if that helped. Like I said, it was late October, so it was probably a matter of cooling off. If it was warm in the restaurant, I wanted to do whatever I could to feel more comfortable. That didn't help. I finally went back in. Sarah and I went back in, and I took some cash out of my wallet, gave it to my brother, and said, pay for it. We had already ordered our meals. I said, just pay for our food and do whatever you want with it. I gotta get out of here. I don't feel well. We had parked maybe a block or two away, and walked back to the vehicle I was driving at the time. Was actually my father's vehicle. My father had a Ford Explorer I was driving at that time. I don't know why I was driving that. Anyway, yeah, because he still drove at the time. Anyway, got back to the vehicle, had unbuttoned my shirt, and took my shorts off. I just felt like I needed to be free. I needed to breathe. I didn't want any clothing on me. I just felt like I couldn't breathe. Obviously I could, but it just was uncomfortable. But by the time we got home, I was fine. It had passed. I felt no more issues, and that was nice. That was good, but it probably didn't help my thought of that was a panic attack because I was in a social situation. I don't always do well in social situations. That was a big reason I drank so much in my 20s. Was didn't want to be in some of the social situations I was in. Anyway, and that was the end of that. Maybe once or twice. I don't really remember any other issues of any significance after that. But in all likelihood, looking back now, they probably were there and I just didn't recognize them. And then, so 2014 was, it was the end of February, and I thought it was a leap year, but 2014, was 2014 a leap year? I don't think it was. Anyway, Sarah and I were on our way into downtown Greenville again to eat. Maybe it's downtown Greenville. It gets me. Yeah. Anyway, we got down Wade Hampton near the high school where used to be a Kmart across the street. And my bank was across the street from the Kmart. And I had pulled in there because I was going to get cash at the ATM. But I also pulled in there because I couldn't breathe again. Same thing. I just felt like I needed to expand my chest. Like I could not open up enough for my lungs to fill. Just couldn't do it. I got out of, I was driving Sarah's vehicle, but I got out, was leaning on the car, was arching backwards over the car. It's that weird feeling like I just cannot broaden my chest enough to get the air I need. Eventually, with no relief of those symptoms, I told Sarah to drive and to just take us home. And we started back towards Greer, up Wade Hampton. And at some point, relatively close to home, or relatively close to where we would normally turn to come to my house, I said, you better just go ahead and take me to the hospital. So I didn't know at the time. I'll continue before I go that direction. We went to the hospital. My what I found out later, I guess, was that my rhythm was all over the place, and it was causing wild fluctuations in my pulse and my blood pressure. So they did what they had to do. I don't remember exactly, but based on what I've experienced since, they probably gave me the 4 baby aspirin to chew up. I know they gave me at least 1 shot. I'm guessing adenosine. Pardon me, I got a fart. Excuse me. Excuse me. That's going to happen a lot today. You're welcome. I don't remember exactly. Like I said, I'm guessing adenosine, which normally is something that will sedate you enough that you are virtually, if not literally, unconscious. And they can do whatever they need to do then to get your heart back in rhythm, which usually means boom, boom, boom. The paddles. You know, the things you see in the movies where they say, clear, and everybody jumps back and they, poochoosh. Yeah, and that's exactly how they do it, because I was awake while I got to experience that joy. The doctor apologized and said, this is going to hurt, and I'm sorry we have to do this while you're conscious. Normally we wouldn't do this until you were unconscious, but we don't see any relief and you're getting worse fast, so they wanted to go ahead and hit me. Now, what those things do is hit you with a massive amount of electricity. I don't know if it's volts or amps or whatever. Somebody smarter will have to tell you that. But it hit me in a way I can't imagine anything else hitting you like, except maybe, and this is speculative because I've never been hit like this, maybe a shotgun blast at close range right into your sternum. Pretty much what that felt like. And being awake and experiencing that pain, I screamed. I mean, I screamed like a little bitch. It hurt so bad. But it did the trick. It immediately puts you right back into normal rhythm and everything levels out and it all's good. So I was, what's the term they use in the hospital? I was stable. Yeah, I was in stable condition, but not in a condition that they were going to just send me home. Because it's cardiac and because I have a pre-existing condition, I guess maybe is how they were looking at things. This is what I started to say a minute ago. I didn't know this at the time, but the Prisma Health System prefers all cardiac issues to be handled at Greenville Memorial. I was at that time in Allen Bennett Memorial. I think it was still Allen Bennett. Had Greer Memorial opened by that time? I really don't remember. I think it was Allen Bennett. Anyway, so I'm going to get transported. They're not going to let you drive yourself across town when you just had a heart issue. So eventually, I'm going to say like maybe an hour or two later, because I guess they only have one ambulance that runs between the hospitals. I got on the ambulance. I eventually learned that ambulance had been somewhere else. And did you guys just see that truck like come right up to my ass like that? Anyway, so I'm in the ambulance now. They're taking me across town, and I hear they're talking to me, and I said something about, you know, they hit me with the cardioversion. That's the paddles. And I told them, I was like, yeah, I screamed like a little girl when that happened. And I could hear the driver laugh, and the person that was in the back with me said, oh, that was you? So they were in the ER and transporting someone else before they came back to transport me. I said, yeah, that was me. I screamed, and they laughed, and the guy up front goes, we thought you were a psych patient. So apparently only crazy people scream like that, but I did because it hurt. And I'm going to tell you right now, I'm going to express some vulnerability. I've told other people this. That's the most pain in one instant I've ever felt. Now, I've had painful things, surgeries and whatnot, that have lagged over time, But in that one short burst, it was excruciating. My chest was tender to the touch for a couple of weeks. I had nightmares. And to this day, if I'm watching a movie or a show on TV and they go to do the paddles, I cannot even look. I just can't watch. It's a traumatic experience. That's my trauma response to have that little bit of a freak out with the paddles. So because of my underlying condition, the VSD, the murmur, the childhood, or what do you call it, the congenital defect, they have to be super careful, and they want to look at everything, and of course they did all the ultrasound and EKGs and blah 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 blah, looking at my heart. They decided that I would benefit from an electrophysiologist looking at it, Dr. Rubenstein, who I am glad to find out is no longer practicing, because he was a turd, didn't really care for him. But he ended up doing what they call an ablation. They go into your arteries on both sides of your groin, up through the femoral artery, into your heart. Find the areas, the electrically conducive areas that are misfiring, and basically cauterize them, just like burn them out, so that they don't carry those rogue electrical signals anymore, and foul up your heart rhythm. That happened in, I think it was March of 2014. The medicine he had put me on, I was led to believe was a temporary thing. He said, we'll do this ablation so that you're not on this medicine for the rest of your life. I said, okay, sounds good. I don't want to be on any medicine for the rest of my life that I don't have to be. But at the same time, I don't want that heart stuff happening anymore, so I'll do what you say. So I start on this medicine. They do this ablation, and I don't remember how long later we had the follow-up with this Dr. Rubenstein, who they will call an EP, an electrophysiologist. There's more of those EPs to come. And I told him that I still, every now and then, would have the feeling of one of those little episodes coming on, but it was very, very short-lived and never really amounted to much of anything other than just a slight, very slight discomfort in my chest. And he said, that's normal. He said, you're probably still going to have those. They're just going to be short-lived and lead to nothing. And that was the case. And then jump forward with no further problems, keeping in mind that between that ablation and current times, let's just say that from that ablation going 5 years forward, I had 7 orthopedic surgeries with no issues. I had multiple procedures for some kidney stones. What else? I guess that's about it. I had a lot of medical stuff going on. The heart was never an issue in any of those things. Now we're looking at February of 2023. My father's in the hospital. He had this was when he was diagnosed with congestive heart failure. I thought he was having symptoms relative to either his kidneys or possibly COVID. Well, turns out he was COVID positive, but the symptoms he was expressing were not COVID related. He had COVID and was asymptomatic. So I went home and tested myself, and of course I was COVID positive too. I was having symptoms. I was sick. It wasn't like super dire or anything. I had like cold symptoms. Anyway, so he's in the hospital. I think he went in on, well, I know when he went in. He went in on February 4th. You can check me. Pretty sure February 4th of last year was a Saturday. I called 911 because I knew he'd fight me about going to see a doctor or going to the ER. So I called 911. They came out. They checked him out up and down right there in the living room. Said his lungs were clear and blah, 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 blah. But they took him in anyway. At that time, he weighed about 235. But he had been weighing 235 for the previous, I'll say at least 8 years. Because that's how long I had been his caregiver. So, they diagnosed the congestive heart failure. I guess they saw the fluid, the excess fluid, and the, I don't know, maybe he had some swelling that they were noticing or whatever. Or x-rays may have shown fluid in the lungs. Anyway, so they're treating him. I actually, at that point, already had an appointment with my cardiologist, Dr. Voss, on Valentine's Day. What better way to celebrate Valentine's Day than to have him look at your heart? And it was a little problematic. They were seeing some things they weren't super wild about. They did an EKG. And what happens on an ultrasound or EKG when they're looking at your heart and you have a murmur, so there's... the blood flow is not normal because of the hole, right? So if you think of like a little tidal pool or a little pool in a creek where the flow is broken in an area and just kind of swirls in a little side circle, right? It's not flowing with the rest of the creek or the river because this little tidal pool swirly area is not getting the flow through it. It just kind of has this flow, circular flow. Well, that's what my heart's doing. There's blood in there that's distorting the image of the EKG because it's producing interference in that blood flow, and they see it. But in so them seeing that, they aren't seeing what's behind it, which is what they were so curious to see. It was it distorts the imaging that they're trying to get. So they scheduled me to talk to the electrophysiologist. He and I discussed things. He actually took me off of the metoprolol, said he wasn't seeing much of an electrical issue. It was the VSD. And I tend to use VSD synonymously with murmur, because I think there are other forms of murmur, but mine is a VSD. Anyway, but he did express concern, Dr. Voss did, the EP did, with this abnormality showing on the EKG. He said, but we won't do anything right now. He said, we could do a TEE to get a better look. He said, but I don't think that's necessary at this moment. Keeping in mind, I was still exercising every day. In addition to all those surgeries and stuff I had, I was also competing in duathlon races. I was doing bike rides as far as 75 miles. I was always overweight, but never inactive. I was always very active. Lifted heavy, did lots of cardio, all of that stuff. So I said, okay, we'll just keep an eye on it. So then in October of that year, October of 23, going on a year ago now, I started having some symptoms. At one point, they thought maybe I had some blood clots. They sent me for ultrasound on my legs. Turns out they weren't blood clots. They never really were diagnosed as anything, to be honest. So I guess they went away. Don't really know, I guess. Anyway, but it did get them looking then a little more closely when I had my follow-up with Dr. Voss, which was a year to the day later, which means I was back at the cardiologist on Valentine's Day. He said we need to go ahead and do this well, they did a regular EKG. I understand, probably because of insurance, they have the order of things they have to do them in or these procedures in a specific order. So they did the echo. It showed again the abnormalities. And so he went ahead and scheduled the TEE. TEE stands for transesophageal echocardiogram. They go down your throat to do the echo. Why would they do that if they can do an echo from the outside? Well, because your throat is right next to your heart, and there is less interference. You aren't having to try to shoot through bone to look at the heart that way. It was a time-consuming procedure, but it was not at all bothersome because they sedate you. Last thing I remember was them putting the tube down my throat, and then I woke up in the recovery. It literally was that easy. I'm going to stop for a minute because we've got a little something going on here on the highway. Back in a few. Alrighty, we are on 26. I didn't see a wreck. All I saw was people that don't know how to merge at the end of 385, merging into one lane to get on 26. Standstill traffic for a merge. God almighty, people. Alright, so where was I? We're talking about the TEE. Yes, they go down your throat, get a better look at your heart, and he had said, Dr. Voss, the cardiologist, had said that, you know, they also could do a cardiac MRI that gives you a much better picture, much more clear, able to determine more, blah, 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 whatever. He said, but let's do the TEE first, and we'll go from there. Okay, you're the doc. I've met my out-of-pocket max for the year. Let's go for it. So this was like late spring. I don't know when exactly. I forget now. It's kind of been a whirlwind a little bit. They do this TEE. I guess they seem just kind of more of the same. There's an abnormality there, but they can't quite put their finger on it. The first diagnosis I got from Dr. Voss was later found to not be the correct diagnosis, or at least the diagnosis they're going with now. But they came to the diagnosis they're working under now came when they did do the cardiac MRI. So let me tell you about a cardiac MRI. I mentioned all of my orthopedic surgeries and my issues with kidney stones. I had 3 kidney stones in less than 18 months, so they wanted to do some investigating then. I don't remember if it was just ultrasound, or I know they were what they call KUB X-rays. I don't know that they necessarily did any MRIs on that, but anyway, I've had a lot of MRIs. One of my shoulder surgeries, I was a willing participant in a medical study, and as part of that, there were extra imaging procedures they wanted to do from time to time, just to watch this new device they were using on my shoulder. So yeah, lots of MRIs, and by far, I mean by a country mile, the cardiac MRI was the worst one I've ever had. I guess I should have been a little curious when every time I discussed the cardiac MRI with somebody, the amount of time it was going to take got longer. Like the first person was like, oh yeah, 45 minutes, blah, 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 blah. It's like, okay, yeah, I've had 45-minute MRIs. It sucks when you're somebody my size and they're shoving you in a tube for 45 minutes, but okay, I can handle it. Not particularly claustrophobic once I kind of get past the hump, so to speak. But yet, nonetheless, uncomfortable. Like, depends on how they have you. I guess for my shoulder surgery, I guess the left shoulder surgery, I had to go in with my right arm up like this, which is not comfortable considering that's the shoulder they did surgery on first. Anyway, so I'm in this, and then the next person I talked to is like, yeah, you know, not all that different than a normal MRI, about an hour or so, and blah, blah, blah. I'm like, okay, because the other person said, like, 30 to 45 minutes, and now it's an hour. And so day of the procedure, I'm in the changing area and I'm talking to some of the technicians, and like, yeah, no worries, we'll be in communication with you through the whole thing. Didn't tell me what they were going to be communicating. I'll tell you that in a second. You'll be able to talk to us, we'll be able to talk to you, blah blah blah. Yep, and then we'll be done in like an hour and a half. I'm like, fuck me. The time is now doubled. Let's get started before it doubles again. So I'm in the tube, and yes, they will communicate with me, and what they will be saying is to take a deep breath and hold it. Still holding it. Like, you are putting a big man in a tube with a heart issue, telling him to hold his breath. I mean, there were a couple times, like literally, where I would like kick my legs to try to give them a clue that I can't hold my breath much longer. That really sucked. That was, like I said, the worst MRI I've ever had. I've had worse medical procedures, but not MRIs, not something that would normally be just classified as imaging. Anyway, so I guess with the MRI, they saw things a little more clearly. Things are a little different than what they had anticipated, and they are now working under a different diagnosis after Dr. Voss had diagnosed it as what they call tetralogy of Fallot, F-A-L-L-O-T, if I'm remembering correctly. You can look that up if you want to, or you can just trust me that it's not an everyday kind of thing. But that was not the correct diagnosis. He referred me to a specialist in adult congenital defects, adult congenital cardiology. So this new doctor, who everyone just calls by her first name, Dr. Manisha. I like her last name because it's so different. It's hard to forget a name that's that different. But then again, Manisha is not an everyday kind of name either. Very nice Indian woman who is extremely well educated, which is comforting to me. I'm not exactly sure why, because C's get degrees, as they say. But we're talking Emory, Penn, Duke. The lady's been at some good institutions. And she is diagnosing it currently as double chamber RV. So RV being right ventricle. My right ventricle has had rogue tissue growth that has formed another wall. My if we're going to call the right ventricle the fourth chamber, mine is now the fourth and fifth chamber. And she said, we don't deal with that very often in Greenville. I would like for you to be seen by the pediatric cardiology department at MUSC. For those who don't know, MUSC is Medical University of South Carolina. It is not where the rest of the University of South Carolina is in Columbia. It is in Charleston. Consequently, I'm on my way to the beach. Yay! Not going to be a fun time. Probably not going to get any sand between my toes. But I'm on my way to Charleston to get what's being kindly just labeled as a heart cath. It was initially scheduled for August 8th. I think that's a Thursday. And the reason it did not happen then is because of Hurricane Debbie. So I was going to head down on the 7th, which would have been Wednesday. Monday, which would have been the 5th, I had just dropped my father off at dialysis. I was probably less than a mile from the clinic when I got a phone call from MUSC, which I had been anticipating. And so I quickly pulled over, got my notepad and pen out, and all I really had to write down was, it's been postponed. The hurricane's coming. They are I think it's Sean Livingston. I hope I'm not making that name up. But the pediatric cardiology is in the children's hospital there, and it's right on the water. They're going to flood. They said they flood every time there's any kind of hurricane coming through, and that it would be in everyone's best interest to reschedule. And I was very disappointed. I was ready to get this over with, because as time has been going on, my symptoms have gotten a little worse. I have not felt very well. My arrhythmia episodes have been increasing in frequency and magnitude. And so I was ready to just get on with things. I rescheduled. She said she would call me back to give me the rescheduled date, and she did call me back later that same morning. In fact, not very much later. It didn't take her long, but she did call me back to reschedule. In the meantime, I rescheduled my hotel room. I rescheduled because they do want me to come down the day before, and I may have to stay overnight, so I thought it'd just be best to go ahead and have a hotel room for a couple days. That it would be best to come down the day before, stay overnight, get up in the morning, do the procedure, either go home to the hotel that night or the next morning, because there's a small chance I'll have to stay overnight. I took care of those rearranged plans. I had already worked. I was going to miss work Friday, so I contacted my boss and the guy who was going to cover my shift and said, my plans have changed. I can work my shift, which I did. Blah, blah, blah. So that was August. I ended up working August 8th. 2.5 weeks later, no, let me back up. Let me tell you some more fun from that part. So that was Monday. They called to cancel. I would have been leaving Wednesday afternoon. I was going to just go ahead Wednesday and take my father to dialysis, do errands I needed to do, and then when I picked him up and took him home, I would gather my things and hit the road. Well, Wednesday, when I took him to dialysis, in the meantime, the weather forecast had changed a little bit. Charleston was not going to get the brunt of it like they had anticipated. I dropped my father off Wednesday morning at dialysis. I got very near the same spot that I was at before when they called, and the phone rang again, and it was MUSC. I didn't know it was MUSC because it actually said a person's name as caller ID, but I've learned between my health issues and my father's health issues, I have to answer the phone even if I don't know whose name that is. As it turns out, it was the doctor's name. He called me himself from his cell phone, which is a little weird, unusual to say the least, but it was very nice because I was able to talk to the doctor and ask him some questions that actually put me at ease a little bit. But the reason he was calling was to tell me, hey, I know we postponed because of the rain, but they're saying now the rain's going to subside overnight. We can still get you in here first thing in the morning if you want to. The reason I'm calling you and not a nurse or a scheduler is because most people have left the hospital as they were advised to do, but everybody will be here to do the procedure in the morning if you still want to come down. And as much as I would like to have gotten it over with then, I also didn't want to try to rearrange everything on the last minute. Would those involved blame me? Probably not, but I didn't want to be an inconvenience to all involved who were helping me through the situation. Sarah had agreed to stay and see to my father, and her parents agreed to go to Charleston because I was told to not come by myself. Needed somebody there that could at least, if nothing else, take me to the hospital and take me back to the hotel afterwards. So I didn't want to have to rearrange all that again. I appreciated what the doctor was doing, but I told him, I said, I've already made plans once and rearranged them once. I don't want to rearrange them again. I appreciate that. And so then I was able to ask him, say, hey, if you have a couple minutes, I have some questions. And my two main questions were, because I've already been sent things on the MUSC, my chart. It's not the same my chart as Prisma uses, but nonetheless. And this procedure was just labeled as a heart cath. And so I asked the doctor, I said, look, I understand this is just being called a heart cath, but if it were just a heart cath, why aren't we doing it in Greenville? He said, well, a heart like yours is abnormal, unusual at best. So in Greenville, they might do one of those per year. And he said, down here, we do about 400 of those per year. And I thought, okay, that makes a lot of sense. Go to where they're going to have more experience, maybe know a little more about this particular issue, and go from there. So my second question, my biggest question in terms of, I don't want to say anxiety, but yeah, maybe a little anxiety, was what were the chances that I go in, they do this procedure, I'm unconscious, I'm sedated, and when I come to, I found out, what are the chances I find out, they've had to do more than they initially anticipated, and now I am stuck in this hospital for days, weeks, I don't know how long. And I told him, I said, I have an elderly father I take care of, and I'm okay leaving him in Greenville for 2 days. I'm not okay leaving him in Greenville for a week or more. And the doctor was very honest with it, very frank. He said, I would love to tell you that the chances are 0%, but that's not reasonable. But I will tell you the chances are less than 1%. And so I was good with that. I was happy with that. I'll take those odds. So, yeah. I did think about it later as like, well, I know you said the rain was going to stop in the middle of the night, but if I'm coming down the night before, that means I'm still going to be driving down in that heavy rain. And assuming I could reschedule my hotel room for the same time, I don't know that the hotel is open. Maybe they had flooding. They're actually a little closer to the water than the hospital is. So it just wasn't going to, it just, in my mind, wasn't a good idea to reschedule and go down there then. They rescheduled me for tomorrow, the 23rd, and I'm on my way to Charleston now. So all of that said over this very long opening section of this video is to tell you what I'm doing. I'm going to Charleston. See ya. Alrighty. I am, I guess we're technically still in Columbia. I just got on I-26 East. Traffic really kind of sucks, but it's opening up now. So, I'm going to back the story up just a little bit more. So I had the initial trip down here rescheduled, and that was supposed to be August 8th, Thursday. August 14th, a Wednesday, I'm working an extra shift covering for my buddy, same guy that was going to cover for me the previous Friday. And around 6 o'clock, I kind of had a arrhythmia episode, kick up a little bit. Nothing too bad. Like normal, I just kind of hunch over a little bit, take a few deep breaths in the nose, out the mouth, maybe cough a few times. Coughing will do that to you if you're having a little rhythm issue. Give yourself a couple of good hard coughs. And I felt like it had subsided enough. It was right around the time that I would normally go get coffee at work. So I walk up front, I get some coffee, I go to the bathroom while I'm up there. I come back in the office drinking coffee, and it's still going. It's still kind of messing with my chest a little bit. And a member actually saw me first. Nice young guy named Dylan. And he looked in the office, big glass windows there, and didn't have to verbalize it. I could read his lips, and gave me the sign language of basically like, "Are you okay?" You know what I mean, like the. And I shouldn't have said anything, but I just shook my head no, which I realized later was like, damn, I could have done him a little better than that. But I was not doing very well at that point. And I'm looking at my watch because I've got my heart rate monitor there, and my pulse is pretty low. I thought I need to check my blood pressure. Of course, couldn't find any blood pressure machines in the office. They're supposed to be there. There were none. Actually, there were, but they were not with all the other blood pressure stuff. For some reason, we don't keep them all in the same place. And I never found the automatic ones. And I have my own little portable EKG thing. It's like just a little, it's got two sensors you put your fingers on. It works with an app on your phone. I did a couple of EKGs there. One came back normal, one came back with arrhythmias. But that also had my pulse low once, and then my pulse high once. So things were all over the place. In the meantime, I've had a couple other people notice that I'm in a little bit of I don't want to say distress, but things are a little abnormal at the moment. So I get it, and to be honest, I had a little bit of comfort knowing that we have an AED machine, a defibrillator, another word for the paddles, at work. And if it came to that, then hopefully somebody would remember their training and could apply that to me. But as is all the employees' tendency, and myself included, I'm just going to call 911. And that's what they did. By this time, I'm feeling like it's getting better. It's not 100%, but it's better than it was. And I decide that I'm going to walk out front and wait for the ambulance. Part of that was my own not wanting to have any more attention than I'm already going to get because of this. So I decide to walk up front. My vehicle is parked not very far from where I was walking, so I went ahead and put my stuff in the vehicle. In the meantime, I have a coworker who's freaking out, won't leave my side, which I guess was nice of him. But I said, "Where are you going?" I said, "I'm just going to go put my stuff in the truck. I think we're all right. Just relax." And sure enough, a truck shows up. A fire truck shows up, and an ambulance shows up. Two on the ambulance, 3 on the fire truck, and I'm sitting on the little bench out front. Which in hindsight, I maybe should have walked. Well, they would have pulled up where they pulled up anyway. Now everybody walking in the building, even those that wouldn't have been coming back to the fitness center, anyone coming and going is now going to see it's me, and there's medical help for me without them knowing any of the story, backstory or otherwise. So they start doing all the normal things, EKGs and checking pulses and blood pressures and oxygen saturation and all of that. And in the meantime, things are slowly stabilizing. And they found nothing, because by the time we got to that point, there was nothing for them to find. I was back in normal, and I went home. I probably should have probably stayed at work, But it was a Wednesday and it was a dialysis day, so I was like, okay, cool. I will go home. And that way my father won't be late for dialysis today. So that was Wednesday. Friday morning came, no issues. I went to work. Everything else was normal. My weights that I would have done Saturday and Sunday, no problem. Monday, oh, no, I guess I did miss a weight routine in there somewhere. I don't know why I got off track on the weights. Because Monday, which would not normally be a lifting day, I decided to go ahead and do the routine that I'd missed. And that would have put me back on track, the plan I'd been following. And that routine on that day, which was day 3,326, I do a 1K ski, which tends to jack the heart rate up pretty good. I mean, pretty high. And then a 2K row, which also gets that heart rate up pretty good. Altogether, that's less than 15 minutes worth. But it's a good warm-up for weightlifting. I'm going to do 2 supersets. That's 2 exercises that you do, 1 set of each back and forth until you're done. It lets you get two exercises done in quicker time because not as much rest time is required. And then what they call a giant set, which is anything more than just 2 exercises. I do 3 exercises that I just do 1 set of each and go through that 3 times. Once again, it's just a matter of synergistic muscles done with less rest time. Just means you get your workout done quicker. And then the last thing would be 1 more superset, and it was a very simple close grip bench supersetted with a kettlebell pullover. So it's a push and a pull, and I couldn't get started. My heart started being crazy. Now I'm an hour into this workout. It took me longer than it should have because I did have a little bit of an issue that slowed me down some, but it passed quickly, and I went on with my workout until I couldn't. The last set, I got the bar loaded, I had the bench in place, I was ready to roll, everything was ready to roll, and all I could do was lean on the bar. I just couldn't get started. I couldn't breathe. It just was not stabilizing, not doing well. And at this point, this is closer to 7 o'clock. Sarah's at the house. She sees me in a little bit of distress, wants to know what I want her to do. I said, nothing, I'll be all right, it'll pass. And then I started thinking, maybe I need to get her to take me to the hospital. And then I quickly came to realize that it was not going to be something that she could handle, or I could handle. That we needed more than just getting to the hospital. I needed somebody then and there, and we called 911. So they came to the house again, same, just like before, fire truck and an ambulance, 5 people or more, completely blocked off my street. I have a narrow little street. They had it blocked. I did see a couple of cars that came, turned the corner and saw the block and did a 3-pointer out of that neighborhood area. And this one was worse because my rhythm just would not regulate, stabilize, whatever you want to call it. I was doing the in the nose, out the mouth thing as best I could. It seemed to help a little bit, and then not. My pulse was all over the place. My BP was all over the place. It was just mayhem. And at this point, I'm sitting in a chair at the end of my driveway. I managed to get that far. I actually asked Sarah, when she called 911, to please ask them to not have the sirens on. It is such a small, quiet neighborhood. I just thought that was going to make such a scene and alarm people that maybe didn't need to be. But they said that's against policy. that's not a request that they can offer. So I'm sitting there at the end of the driveway. We finally get to the point where they're comfortable getting me in the ambulance, and again, the rhythm's not quite right. I've already been telling them that I've gotten the paddles before while I was awake, and I would do anything that I could do to help them avoid having to do that again. And they had a really neat little trick, and it worked. We didn't have to do the paddles. So I'm sitting up, right? I'm on a gurney. My legs are out in front of me. I'm sitting upright. But my legs are on the gurney. I'm sitting in the shape of an L, so to speak. And they give me this thing to bite down on and blow in, except there's nothing to blow in. I'm essentially like holding in a sneeze. I'm blowing as hard as I can, and the air's not going anywhere, so I'm just blowing against the wall. And the instant I feel like I absolutely can't do this anymore, they flop me back and lift my legs in the air. And that big fluctuation of body position, in addition to the internal pressure of the blowing, changes your rhythm, your pressure, and everything just flip-flops when they do that. But it worked. And I think we did that 2 or 3 times in the ambulance, which was weird, but it worked. And that's, to me, all that mattered. Got to the ER, and I think we might have done it 1 or 2 more times at the ER. They realized I had already had the 4 baby aspirins chewed up. I'd already had a shot of adenosine, and maybe something else. Oh, maybe I think they started an IV drip of another drug that was going to help balance things out a little bit. And so they kept me overnight, obviously, and then sometime around 2 in the morning, I got into a room, and they had me on a no eating or drinking, because if they have to go in and do something, they don't have to do it on someone who does not have an empty stomach. Now, keeping in mind that at that point, it had been 12 hours since I'd eaten. Normally, kind of like tonight, I can't eat anything after midnight. Well, I'm going to eat before I go to bed. I'm going to eat shortly before the you can't eat anymore order. But that day it had already been 12 hours. I was already hungry when they said you can't eat or drink. And so all of Tuesday, I could smell breakfast getting delivered to the other rooms, but I wasn't getting any. And the 2 times that I was to take any kind of medicine, I got about an ounce of water to take the pills with. So yeah, I couldn't eat or drink anything. Didn't feel great. But they were trying to decide if I needed an ablation. And if I did, could they wait and let MUSC do it at the same time they wanted to do this other testing? Or did they need to do it there in Prisma, in the Greenville Hospital? I got a phone call from MUSC. I think it was a phone call. Might have been an email. I'm pretty sure it was a phone. No, it was a phone call. I got an email later. I got a phone call saying that if they wanted to wait and have them do the ablation in Charleston, that would be fine, but they would have to reschedule the whole thing until the 3rd week of October. And at that point, I just wanted to puke. I thought, I cannot have another postponement. And now, in the space of 5 days, I've had the ambulance called on me twice. I couldn't keep doing that either. So Tuesday afternoon, much later than I anticipated. I thought they're not going to do procedures this late in the day, but they did. The EP came to the room. This was after some more EKGs and some of that stuff. the EP and his crew came to my room and said, "Hey, you wanna get an ablation?" It's kind of like he was asking me out on a date. Like, "Hey, you want to do this?" I said, "Now? Today?" He said, "Yep, right now." Like, "Yeah, cool, let's do it." So he said, "All right," and they left and went to go start getting things ready, I guess. And they strapped me down and flattened my bed and started wheeling me away to the lab, the cath lab, as they call it, I guess. And they did an ablation. Now, something happened. I don't know. I didn't really get the whole story. Nobody told me what happened. But they had already mentioned, and I already knew from having an ablation before, that is something they do with you awake. It's not fun, but it's necessary. Why is it necessary? Because when they get in there and they start looking at those rogue electrical paths, they don't know which ones are misfiring, so they stimulate them. And then they can tell by your reaction if it's a bad one or not. When I had my first one, there were times where I felt like I literally was coming up off the table. That's how they know. Oh, here's a bad one. They take care of it and you go on to the next one. So I guess we're already in the cath lab kind of talking about these things. And the next thing I know, I'm waking up in recovery. So something happened where they had to put me completely out while they did it. And then the EP came to the room because they have to go in your groin. And when they go in the femoral artery in that manner, you have to lay completely flat and still for 3 hours afterwards to make sure that artery heals back up. When you hear in movies or whatever about people bleeding out from leg wound, it's usually because the femoral artery gets severed or punctured in some way, and that is a massive flow of blood, and that's how you bleed out. You lose a lot of blood quickly. So to avoid that, after using that artery for access to your heart, you have to lay there for a minimum of 3 hours just to let them kind of be comfortable with the healing of that access. So yeah, I'm laying there in the bed still, and the EP comes in and says everything went fine, showed me some pictures of the areas where they zapped, and I guess just to kind of prove that they had done anything, which still wasn't a whole lot of proof. It's kind of weird to look at, but they have pictures of the inside of your heart. And that was it. That was late Tuesday afternoon. I didn't get dinner. No, I didn't get dinner. So now it's been a full 36 hours. I mean, half of Monday, all of Tuesday. And when breakfast got delivered Wednesday to my hospital room, I was taken back to my 35th birthday when I was in the hospital, freshly diagnosed with diabetes, and I was being brought the absolute worst breakfast a diabetic could have. But here we were all these years later, and once again they're giving me a breakfast that a diabetic shouldn't have. So there were scrambled eggs. I'm going to guess that was about half a cup worth. I mean, it could have fit into my semi-closed hand. There was a little plastic cup with about 8 or maybe 10 little pieces of fruit, like mixed melons and maybe a grape or two. I don't remember. It was kind of like the fruit I give my father. And milk. I ate eggs, the fruit, and drank the milk. What I didn't eat or drink was orange juice, all carbs, biscuit, all carbs, grits, all carbs. Like, what are y'all doing to this diabetic laying here in your hospital bed, and you're giving me all this crap, garbage, carbohydrates? So I was still starving. I was very glad to have something to eat, but it was not a lot. It was enough to kind of just made me hungrier. But it was good to get the nutrition at least. And make me all the more anxious to get down here to Charleston and get this taken care of. They were, I think, as relieved as I was that they didn't need to postpone this. But they were made aware of the fact that my condition was digressing in a way that needed some prompt attention. And so once again, that's another aspect as to why I am on a Sunday afternoon driving to Charleston. See ya. Now, I got my half-hour of cardio today, but I just had some pizza and a salad. And what else am I gonna do? I'm gonna walk on the treadmill a little bit. All right, so here we are. I just wanted to give you a little bit of my view from the hotel room. Yeah, nice spot. All right, so anyway, I'm going to choose to do this out here because, because I love this view. So today's procedure was diagnostic, I guess you would classify it. Maybe classify it as exploratory. It was a heart cath. There was some other testing involved due to the nature of my my congenital defect. And Dr. Rhodes decided upon review that this was not a new development. I was misdiagnosed for the last 53 years. I have a heart condition that necessitates some form of intervention. They do not know yet at this point what type of intervention. This is the second cardiologist I've had who says they will present my case in conference. In other words, he will meet with cardiac advisors and they will review any case study they may find and use that to decide what should be done in my case. Unfortunately, against what I had hoped for and actually asked for, if possible, that intervention will take place here in Charleston, not in Greenville. No, I'm not staying here now. I am going back to Greenville tomorrow morning. Got things I got to take care of there, and things that I got to take care of before I can decide when and how and what they're going to do, or actually they decide, and then I decide when. Not looking forward to that. Not looking forward to another trip down here where I don't necessarily get to enjoy the beauty of Charleston. But it is what it is, and if it's your heart, you have to get it fixed. So I was there from about 7 o'clock this morning, and we left probably, before 3, I think. Pretty sure it was before 3. Somewhere between 2 and 3. Anyway, they wanted to keep me about an hour of laying flat. I don't see it, but I sure hear it. Anyway, it's really bright out here too. They used a collagen injection into the access in my femoral artery, and that does not require the 3 hours post-op laying down. It is heals a little quicker and a little safer, and so I was able to get out of there fairly quickly. No driving for 24 hours, which is why I'm still here. I will leave tomorrow mid-morning. Actually, checkout I think at the hotel is 10 or 11. But I'm not going to jump right on the road to get home. I'm going to stop a couple places here in Charleston before I can come back to Greenville. Very grateful for the Olma family and their help. Couldn't have done it without them. Sarah taking care of Walt, and Sarah's parents getting me back and forth to the hospital. I guess that's about it for now. You'll know more when I know more, and maybe I'll talk to you some more tomorrow on the way home. Thanks for watching this extraordinarily long video. Alrighty. I am back on the road on my way back to Greenville. So I guess the synopsis of this little trip to Charleston is came down for MUSC. They found, I think, kind of what they expected. I kind of have gotten the impression that they really just kind of wanted to verify what Greenville found because it's not every day they find it. Because now we're going to just have to wait to see what they want to do about it. Nobody's going to, well, I hope they're not going to rush to a decision about what to do. So, yeah, I think I've already mentioned my cardiologist in Greenville will discuss with the cardiologists and the EPs and whatnot here. They will present this in what they call in conference. In other words, amongst their peers, they will discuss what they think is the best course of action. And in all likelihood, I'll end up back here. Doesn't sound like they want to do this kind of thing in Greenville. Really wish they would, because that causes all other kinds of complications, but you know all I know for now.